Hi, and welcome to the Commissioner's Report. I'm your host, Jeff Foley, and I'm joined today by Commissioner Martha Santiago and Ann Claussen, CEO of Central Florida Healthcare. Thank you for joining me today.
Thank you for having us.
Thank you.
Commissioner Santiago, what are we here to talk about today?
Oh my gosh, I'm so happy to have Ann Claussen with us because she's going to share some wonderful information about the Central Florida Healthcare. I've seen Ann build this program or these centers all around Polk County, and I'm very excited that she's on our program today to share about it.
So Ann, what is Central Florida Healthcare? Give me the elevator speech on what the organization does.
Sure. Central Florida Healthcare is a federally qualified health center. We're considered an FQHC, which means we receive some funding from the federal government. We are also Joint Commission accredited and patient-centered medical home certified. And so what we do is provide health care, various health care in Polk County. We have 13 locations, and we provide medical and dental services as well as OBGYN, behavioral health, pharmacy, lab, and x-ray.
So 13 in Polk County. What is the population that you serve?
So we serve primarily the uninsured and the underinsured. We also take care of the Medicaid population. We see the homeless, we see the migrant population, and also people with insurance. And so we're considered the safety net provider, and we don't turn anybody away for care if they come to our health centers.
So pretty important service, I would say, providing services to people that otherwise might not have them. I know there were a couple agenda items that the board saw lately, and the board decided to invest $6 million between two facilities. Is that right, Commissioner?
That is correct. We have the indigent health care funds, and through those funds we decided to help Ann and build two more facilities. One in Lakeland, well, she'll talk more about it, but one in Lakeland and one in Dundee, the town of Dundee. So we're excited about that.
So Ann, what can you tell us about these facilities? Why are they necessary? What will happen there?
Sure. So as we all know, Polk County is, I think, the second or the third largest growing county in the country. And so our goal is to continue to try to meet the needs of this patient population. For the last few years, we've looked at expanding Lakeland, and so that will be a state-of-the-art 4-story health center in Lakeland, right across from the Dreadnought Stadium, where we currently are. Right. And that will bring additional services that we provide throughout Lakeland to that location. And then for Dundee, we have a small health center on Dundee Road and right off Highway 27. So by expanding those services, we will be able to bring in dental and OBGYN, pediatrics, and other services that we cannot offer there in that small building. So we're very excited for the opportunity and for the approval through the Board of County Commissioners.
And the Lakeland facility, is that kind of a centralization of facilities? Does that bring a few locations together? Am I correct?
Yes, it does. So it brings Lakeland Pediatrics, that's down on South Florida Avenue, Lakeland Hills Dental, that is across from the hospital, and also we do have Crystal Lake Elementary, but that will stay where it is. So we'll be combining those two services into the new building.
And what is the county's role? How is the county helping this happen? I know they're investing $3 million into each of the facilities. I'm guessing they cost more than $3 million each in total?
They do. So Dundee would be a smaller 2-story, and so that will be probably about $4 to $4.5 million. The Lakeland project is a bigger project because it's 4 stories, but that funding will be used towards building that site, and we'll be able to break ground in July of this year. So just in a few months we'll be able to start, and we're super excited about that.
And Commissioner, I think this is a kind of cool aspect to the story, that the funds the county is committing come from the sales tax that the residents actually voted on, correct?
That is correct. This is the second time. Last election year was the second time the voters selected to provide funds for situations like this, for agencies like this, through the indigent sales tax. And I'm very proud that the citizens have done this, because if not, we wouldn't be able to do the work that Ann is doing and other other agencies, and to meet the needs of the people that need it the most. For example, putting a clinic right there in Dundee is absolutely wonderful, because one of the issues that we see is that people, the transportation, how to get to these places. So putting central clinics like Ann has done in strategic places has really helped. I went to the grand opening that they did in Davenport, and I think that building is like used to capacity. Am I correct?
Yes.
Every single day. So this is important for us, that not only do we serve the people that need it the most, but that we have these clinics where the people can access them easily.
Is that a unique situation where residents of an area choose to tax themselves to help less fortunate people?
Well, I could only say of Polk County. I think Polk County has done a great job to do that, to know that this indigent health sales tax is helping the people that need it the most. So I'm very proud about that. Like I said, this is the second time they've voted for that, and you could see how much they care for the people that need the services.
So Ann, what's the timetable for the new facilities?
So we're planning to break ground for Lakeland and Dundee both this summer, and it will probably take about 12 to 14 months to get that completed. There's been a lot of work that we've already done with our Lakeland site, and then for Dundee, we're going to replicate what we're doing in Frostproof, and so we already have plans, and it'll be an easier, quicker process to be able to get Dundee up and running as well.
And I've seen the renderings. The buildings look beautiful. That's a pretty quick turnaround, 12 to 14 months. What else is on the horizon for Central Florida Healthcare?
So we are, as I mentioned earlier, knowing that this county is growing so quickly and the needs for indigent health care, we are looking to expand services in Bartow, and also looking to expand services in South Lakeland, Mulberry area. And all this is done by doing needs assessments to ensure that the locations that we select are appropriate, that our patients have transportation. So we're continuing to, after these two locations, to also look for additional sites to expand healthcare.
Well, I think that's good news for the residents of Polk County.
Well, this is why this information that Ann is providing is so vital for our citizens in Polk County. So I'm excited that she's able to join us so that she can share these.
Well, thank you both for being here to talk about this with me today. I appreciate it. That's it for this episode of the Commissioner's Report. Please make sure to check us out next time. Thank you for watching. Please make sure to subscribe and like our social media.